Hi everyone, and hoping that you are enjoying this holiday of a Monday. Hindi Manic Monday ngayon, Holiday Monday. Araw pala ng mga bayani today, and I am back here in San Juan, San Luis, Pampanga. So I hope that you can see me clearly. I hope that you can hear me clearly. Please thumbs up lang po kung maganda yung audio o disente. I cannot hope for maganda kasi nasa Pilipinas po tayo. Our background is the Sagum Farm where Dr. J, our mayor, Benji, and his mom, that's me, are staying. So, ang ganda-ganda po ng ating discussion today. We are blessed to be with a breastfeeding expert again to close breastfeeding month, which is the month of August. So, our topic po today, and napakaganda rin ho. Our topic today is breastfeeding, true or false. Kasi ang dami pong mga tinatanong all the time. And siguro po, today na po yung araw na klaklaruhin po ni Doktora Teresa Ribano and myself kung ano po ba talaga yung mga totoo at hindi tungkol po sa breastfeeding ng mga sanggol at mga malalaki na rin hong mga bata. So, we are blessed today. We are guested by she's a pediatrician po, a consultant pediatrician from the Asian Hospital, and she'll be with us in a few minutes. So ako na muna ho magpapakilala for those who are new to us. My name is Dr. Ana York Bondo, and thanks for joining us for an hour and a half for our breastfeeding facts and myths. Ako po ay isang pulmonary and critical care specialist. I'm a psychologist po by training and the wife of a mayor, kaya ho lahat ng mga barangay matters, alam ko. And the mom po of a 7-year-old, no, 8-year-old, kabe-birthday lang ho ni Benji, breastfed child for 5 years. Yun po talaga ay pinagmamalaki ko. So today we talk about one of our favorite topics. So if you're interested po, please like and share lang po sa baba. Sa mga gusto magtanong, ilagay lang po yung mga tanong nyo. And breastfeeding, COVID, non-COVID, welcome po yung mga tanong. So let's tackle and go straight to breastfeeding, true or false. So our special guest today is a consultant pediatrician at the Asian Hospital po and Medical Center. She is also, aside from being a pediatrician po, she's very young, very dedicated, and she's also po dedicated her pediatric practice to lactation. So aside from being a pediatrician, she's a lactation or a breastfeeding specialist. And she has an international certification po in breastfeeding from abroad po, no? You cannot get that in the Philippines. So we are joined today by Dr. Teresa Ribano, IBCLC, attending pediatrician and lactation specialist at the Asian Hospital and Medical Center. Hi, Dr. Tere, how are you?
Hi, Doktora. Good afternoon po. I hope everybody's safe.
Opo, katatapos lang ho ni Dr. Tere to moderate an international symposium of breastfeeding this morning, ano po?
Yes, Doktora. The Philippine Pediatric Society.
So we're here.
Yes, the Philippine Pediatric Society.
So talagang kilala ho si Doktora.
Yes.
So ready na ba kayo, Dr. Tere? Let's do our case. Everyone, I'm sorry, medyo naglalag yung internet so if I interrupt anyone, I'm sorry already. Kasi po talagang kuminsan naglalag po yung ating internet. So, Doktora, I'll read the case po. And then maybe we'll read our first myth, okay? So, our case po is, the letter that we got is, Dear Doktora Ana and Doktora Tere, I am a first-time mommy and I'm so excited po to breastfeed. Kaya lang po, I'm already 40 years old and ang dami-dami pong sinasabi sa akin ng mga tao na hindi ko alam kung totoo o hindi. One of the favorite po na aking biyanan breastfeeding daw is so natural. Bakit pa daw ako kailangan mag-breastfeeding classes? Kasi po, gusto po namin ng husband ko na mag-prepare. So, sabi po ng biyanan ko, relax lang daw at mangyayari yon. And that's not the only thing that she told me. And I keep reading and hearing things. So, Dr. Ana, Doctor, please help me know what's true or false about breastfeeding. So, Dr. Tere, do you want to say, siguro po yung kanya tinatanong is, ang breastfeeding ay napaka-natural. Sabi ko ng biyanan niya. Pagkapanganak, just relax, at mangyayari lang yon. No need to go to classes. So, Dr. Tere, please tell us if this is true or false.
I would say that it may be true for a small percentage of people, but it is mostly false. Um, a lot of people, kailangan nila kumbaga i-condition yung kanilang mga sarili, ang kanilang their minds to be able um, to really get into breastfeeding, because breastfeeding is not an easy task. Ang dami, na-romanticize kasi yung breastfeeding. So parang in our minds, we're thinking about those commercials or those shows where the mom is there, she just got out of delivery, parang fresh siya, tapos ibibigay si baby and then ilalagay na si baby sa breast and baby will just know what to do. But unfortunately, for majority of the moms, it's not the case. But preparation is key because it puts you in that mindset that you need what it entails of what you have to do. It prepares you about what will happen in the first 3 days of life and thereafter. Um, it's very important for the mom to know that these are the expectations in the first few hours, the first few days of life, because if alam mo kung ano yung i-expect mo, hindi ka madidisappoint. And you won't feel like, uh, oh, I'm a failure, or hindi ka magpapadala sa mga sinasabi ng ibang tao. One of the common things that moms will tell me, and when I mean common, I'm talking 9 times out of 10, um, we will see that children who mothers who will breastfeed will tell me, Doktora, I really want to breastfeed but walang breast milk, walang lumalabas. It's important that moms know going into the delivery that at the beginning, there's a very small amount of milk that comes out na ang tawag ay colostrum, na minsan ay patak-patak lang siya, pero sa pagpapasuso ng bata, dumadami siya ng dumadami habang tumatagal yung oras o di kaya yung mga araw. So, kung halimbawa ikaw ay bagong nanay at hindi mo alam kung na normal pala to sa unang mga oras ng pagkatapos manganak, di magpapadala ka sa ibang tao at magpapabigay ka ng ibang klase na na pagkain para sa inyong anak. Isa pa, ini-expect kasi ng ibang mga bagong mga magulang na pagkalabas ng bata, hindi siya tutulog-tulog. Ini-expect nila pagkalabas ng bata, mailalabas siya, mailalagay sa titib, at makakapagpasuso na. Pero kasi hindi ganon nangyayari. Sa paglabas ng isang sanggol, sa simula, meron kang mga 2 hanggang 6 na oras lang na gising yung bata. Yun yung quiet awake state. And in that time, dyan sila natututo kung ano yung amoy mo, ano yung hubog ng suso at ng utong mo, ano yung mga paano ba nakakarating doon sa suso ni mommy, kung paano ba maisusubo yung breast sa bibig ng bata. Lahat yun natututunan niya sa unang mga oras. Pagkatapos nun, matutulog kasi yung baby ng matagal. So, gigising-gising lang siya ng pailang-ilang sandali sa loob ng susunod na 24 oras. Na minsan, dahil hindi alam siya ng mga hindi siya alam ng mga bagong magulang, pilit nilang ginigising yung baby Tapos, na-frustrate lang sila kasi yung baby hindi naman hindi gumigising or hindi maganda ang pagsuso nila. Isa pa, yung breastfeeding classes kasi, importante siya lalo na kung halimbawa yung isang bata na paglabas niya ay may problema pala. Halimbawa, preterm o kulang sa bilang, kulang sa araw si baby, o di kaya kung halimbawa merong mga sakit sa puso, kung halimbawa yung mga bata merong bingot o di kaya yung cleft palate, cleft lip, kung halimbawa ang bata ay hindi pala iisa lang, pero kambal pala o di kaya triplets. So, lalong-lalo na para sa mga kondisyon na yon, importante kasi yon na magkaroon ka ng idea kung ano yung magiging plano mo sa pagpapasuso. Kasi paglabas nun, lalo na si mommy, pagod na pagod, kung first time pa siyang mommy, hindi niya alam kung anong gagawin niya, nakaka-overwhelm. So, importante para sa akin, importante talaga siya na magkaroon ng breastfeeding classes or kahit orientation man lamang on breastfeeding na nagsisimula bago pa lang manganak si mommy. Kaya dito nga namin sinasabi na importante din ang role ng obstetricians at gynecologists sa buhay ni baby. Kasi pag tinitignan naman namin po ang isang pasyente, tinitignan po namin siya hindi lang bilang isang bata o di kaya si mommy lang, kundi isang unit sila o isang dyad. So, yung role ng isang obstetrician is just as important in giving the information to the mom. So, the classes are there. The obstetricians and the gynecologists are also there kung hindi sila maka-access ng mga classes. So, they all play a role para mas maging maganda ang journey sa breastfeeding ng isang mag-ina.
Doktora.
Hello. Hi, Doktora.
Hi, thank you, Doktora. Thanks for that answer. Sorry po, natanggal po ako. But I heard that the role of the OBGYN, ang ganda po niyan. Sometimes we don't think of the OBGYN when we think about breastfeeding. Pero ang ganda po niyan. So I really like that answer po. Na talagang, it's not natural, diba? Well, it is not here. Nangyayari lang po yun.
Yes.
So, I'm happy na that you have to prepare. You have to decide and you have to prepare.
That's right.
So, puntahan po natin yung spectrum, myth po natin. Nakalagay po dito, or true or false, Doktora, sa panahon po ng pandemic, it's so important to use formula kasi nakalagay po doon na may immune boosters po yung formula. So, kailangan po natin ng formula ngayong pandemic. What do you think, Dr. Tere?
Para sa akin, false siya. Kasi ang breast milk ay mas marami ang antibodies at mas marami ang immune factors kesa sa formula. Ngayon, naiintindihan ko na hindi lahat ng bata kasi naka-breastfeed. Ang tingin ko sa formula, ang magiging tingin ko sa formula, para po siyang antibiotic. Hindi naman ho siya iniinom araw-araw ng lahat ng tao, kahit na anong klaseng antibiotic siya. Yung antibiotic, ibinibigay lang siya para sa select na mga tao pag may pangangailangan. Ganun din po ang formula. Ngayon, sa panahon ngayon, mas maganda pa rin na breast milk yung maibigay natin sa mga sanggol, lalong-lalo na yung mga batang-bata, yung mga bagong panganak, lalong-lalo na yung mga may sakit din na sanggol, lalong-lalo na yung mga sanggol na kulang sa edad o yung preterm infants na tinatawag natin. So, false po yun. Importante pa rin, mas importante po.
Doktora, paki-explain lang po. Gusto ko ko po yung sinabi nyo that it's not actually the formula that has immune boosters, but it is the mother's milk that gives us immunity and makes the baby strong. Paki-expound lang ho. Gusto ko yun. At saka yung para sa premature, mas maganda ho talaga ang mother's milk.
Opo. Ang breast milk, hindi lang siya basta parang gatas o di kaya pagkain. Ang breast milk, sinasabi nga po nila, ay isang living thing. Kasi ang daming nagsasabi, kung ikaw nga, lumaki ka, naka-formula, okay ka naman. Bakit mo sasabihin na hindi sila equal? Kasi ang totoo, ang breast milk, meron diyang antibodies na galing sa nanay na makakatulong para makapagprotekta sa isang bata. Ang mga antibodies na nandyan ay hindi lang yung mga usual na antibodies sa mga sipon, ubo, pero in fact, it can become very specific. Kasama sa mga latest na mga data that we're seeing is that antibodies to the COVID virus can be found in breast milk. So, in fact, children can be protected to a certain degree against COVID. Siyempre, because early pa lang po to sa stages ng mga studies, hindi pa natin alam ano po yung extent. Pero, isa sa pinagbabasihan natin, for example, ay the common cold. Ang common cold po is, alam niyo naman po, doktora, ay isang type din po ng coronavirus. So, when a mom has a cold, the mom is able to mount a resistance against the cold because of the antibodies na napoproduce po ng katawan niya. And this antibodies then transfers to the baby through breastfeeding. So in fact, even if the mom has a cold, as long as she washes her hands and she protects against and does good cough and cold and yung sneeze etiquette, she can protect her child because of the antibodies she has that's found in breast milk. Ang isa pa po is that for preterm infants, ang preterm infants are very susceptible to infection. So, all the more na kailangan po nila ng immune factors and antibodies which the breast milk can provide. Bukod pa dun, ang dami pa hong mga ingredients, so to speak, composition ang breast milk na hindi pa natin alam hanggang sa ngayon. Kasi hanggang sa ngayon, yung research pa rin po ay ginagawa, meron pa rin pong mga data na hindi pa rin po final that they do say helps in the development of the immune system as well as the cognition or yung brain development ng isang bata. Di ba naririnig nga natin yan sa commercial ng mga gatas?
Yan. So, ang ganda po na sinabi nyo, opo. I like that breast milk is living and that it's antibodies kasi talaga ngayon panahon ng COVID na lahat tayo naghahanap ng antibody to protect ourselves. So it's really nice to know that breast milk will help the babies. So, Doktora, ito, may nagtanong naman. Kung mahina po ang daloy ng gatas nyo for your first baby, likely, and you failed to breastfeed that baby, likely, hindi na ho kayo makakapag-breastfeed for the next.
False na false. Marami po, false po siya. Marami na po kaming storya, hindi lang po ako, pero lahat ng mga lactation consultants, lahat ng counselors, peer counselors, mga pediatricians across the country na sa unang anak, may nangyari. Hindi very successful ang breastfeeding and yet the second, the third, the fourth child comes in and they're very successful with breastfeeding. Somehow, even at a physiologic level, yung pangalawang bata, kaya kaagad-agad mas maagang pumapasok ho ang gatas as mas maraming gatas ang na-create dahil sa may priming na siya. Kumbaga, yung unang baby, kahit saglit lang siya, kahit sabihin mo nga, 1 linggo lang siya nakapag-breastfeed, kahit sabihin mong isang buwan lang siya nakapag-breastfeed, kumbaga parang na-prime niya na ho yung katawan at saka yung cells ni mommy para mag-produce ng breast milk. So, sa susunod na bata na dumating, nare-recognize na siya ng katawan niya. So, kaagad-agad, mas mabilis na pumapasok ang gatas at mas madami yung gatas na nagagawa. Bukod doon, si mommy kasi natututo din siya. Alam niya na yung mga mistakes na medyo nangyari nung first pregnancy at nung first breastfeeding niya. So this time around, na mas nako-correct niya na at alam niya na kung saan siya pupunta para humingi ng tulong, saan siya makakahingi ng tulong. Lalo na po ngayon, kahit po may COVID, nandiyan naman po ang internet at madami po tayong both professional and peer counselors that are available online.
Ayan. So may hope, there's a lot of hope for the next. Opo.
Yes, ma'am.
Okay, ang ganda nun kasi ang dami nagsasabi once, you know, Doktora, when I tell people, I tell them hindi to CS, okay? Pwede pa.
That's true.
Opo. Okay, ready na kayo for the next statement, Doktora?
Yes. Yes,
And
ma'am.
I'm sorry to tell you, maraming sumagot ng true dito ha. Paki-explain lang po. Eto, pag masakit po magpadede, dapat nating tiisin ng mga mommy dahil mahal na mahal nila si baby. So,
Sasabihin ko po,
so
false.
totoo ba na even if it's painful, tuloy-tuloy lang? Or should they ask for help? Ganun po.
Sa simula, may konting sakit ka talagang mararamdaman kasi hindi naman normal na merong maya-maya na suction na nandun sa breast natin. Pero kasi kung medyo beyond the first latching, lalo na kung totoong naayos mo yung latching, masakit pa rin, hindi na yun normal. So, lalong-lalo na kung halimbawa, nagpapasuso ka at nararamdaman mo na masakit, na parang kinakagat ka o parang merong tumutusok doon sa suso, hindi normal yun. Kaya humingi kayo ng tulong. Ngayon, lalo na sa lying in at saka sa mga ospital, kailangan kasi mabilis na umuwi dahil nga sa COVID. So kasama yan dun sa pagpe-prepare natin bago manganak. Ang pagpe-prepare sa panganganak hindi lang doon sa crib, sa diaper, doon sa damit na iuuwi. Hindi lang doon sa kung paano yung pagbinyag or di kaya pag-bless sa kanila or paano yung mga gagawin nyo now in the new normal. Kailangan nyo rin isipin saan ako pupunta, saan ako manghihingi ng tulong kung halimbawa merong masakit. Again, ang kagandahan sa ngayon, marami nang pwede nilang pagtanungan. May mga peer groups tayo, iba't iba na nasa Facebook. And also, there are many hospitals now because of the Mother-Baby Friendly Hospital Initiative of the DOH. Marami na rin po silang mga lactation counselors and consultants who they can reach out to. So, like in Asian hospitals, we have e-consultations and online consultations. So they can just head up to the website of Asian Hospital and then they can look for myself. They can look for Dr. Eileen Go. They can look for Dr. Christine Lapus. We are the lactation consultants here. And we have lactation nurses here as well. So the help is there. It's available. So mami, wag niyo na hong tiisin.
Ay, ang gusto ko yan.
Kahit po araw ng
walang
kagitingan. Kahit araw ng kagitingan ngayon, bawal ho ang magpaka-hero sa pagpapasuso.
Yes. Ayan. Doktora, if you don't mind, we'll take some questions from the...
Marami pong nagtatanong, Miss Rain, can you please read the questions kasi I cannot see them?
Sure po, Doktora. Hold on 1 second. Doktora
Oh,
Teresa, we have some questions, live questions actually.
Sure.
I'll put on the monitor or the screen.
opo.
First question is from Ms. Rochelle Calma Alfonso. Good afternoon, Doktora. Ask ko lang po kung makakasama po ba kay baby kapag ka nagka-COVID ka, tapos nagpapa-breastfeed ka pa rin.
Kung,
Ayan, Doctora, can you please help Rochelle?
okay.
The question is, can
COVID positive moms, like maybe mild or moderate, should they breastfeed or wag na po? And what's your
Basta,
advice po?
opo. If it's mild or most times pa nga po asymptomatic po ang mga nanay, ang suggestion ko pa rin po is to continue breastfeeding. Ngayon, continue breastfeeding, but do not forget, you have to wash your hands properly, you have to put on a mask while you're breastfeeding. Isa pa nga po sa kanilang sinasuggest is, kung halimbawa nalalagyan ng plema yung dibdib, then that's the time to wash it. Otherwise, just the usual bathing is fine. So, yun naman po yung pinaka-importante. As long as your nose and your mouth is covered and you're washing your hands, then yes, you can continue to breastfeed.
Ayan, ang ganda po. Opo. Yeah, thank you. Okay, Rains, any questions next? Thank you, Doctora.
From Miss S.P. Lopez.
Wear a
Villegas.
mask while breastfeeding. Yan. O, next po.
From Miss S.P. Lopez Villegas. Good afternoon po, Doktora. Paano po madadetermine if maganda ang gatas ng mother? Pinagbawalan po kasi ako minom ng malamig na tubig. Maganda daw po ang quality ng milk kapag maligam-gam na tubig ang ini-intake. Gusto ko din itong malaman, Doktora.
Ayan. Tungkol po sa tubig, Doktora, bawal ho ba ang malamig?
Okay. So, I'll take the second half of the question first. Hindi po bawal ang malamig na tubig. Kahit ano pong temperature ng tubig, kung mainit na mainit at gusto nyo uminom ng tubig na puro yelo, inom lang po kayo. Ang importante po, uminom kayo ng tubig. There are small studies po that show that if you drink warm water right before you breastfeed, it helps with the flow. But again, there's small studies, so hindi ko pa ho ma-confirm sa inyo kung totoo nga ba yung maligam-gam na tubig. But it is up to your comfort level, and it is important that you take your bare minimum na 8 to 12 glasses a day, but drink to thirst o habang nauuhaw kayo. Yung second half of the question is, paano po ma-determine if maganda ang gatas ng mother? Ma'am, the way that you determine it is kung lumalaki po ang inyong anak. Ang diet po ninyo kailangan tama. Wala naman po kasi talagang bawal kainin habang nagpapasuso. Basta po everything in moderation. Yun yung importante. Maganda kung hindi ho makain ng mga maaalat at masyadong matatamis kasi nakakaapekto po yun doon sa volume at doon sa pagdaloy ng breast milk. But other than that, wala naman po talagang as in kailangan kainin talaga. Yung hindi ho na-determine sa itsura kung maganda o pangit ang gatas ng ina. Kasi minsan sinasabi nila yung parang malabsa daw na parang hindi daw puting-puti. Hindi ho ibig sabihin pangit ho yung gatas ni mami. Ibig sabihin lang, yung gatas ni mami, ganun ho ang itsura. Pero hindi ho pangit ang gatas ni mami.
Okay, next question po tayo, Doktora Ana and
Yeah, more
Doktora Teresa.
questions, Rain.
Yes, from Miss Eva Manawis. Doktora, ang mixed breastfeeding ba ay okay? Kasi yung apo ko po, 1 na Vicas, sinabihan ko na mag-mixed breastfeeding na dahil hindi nag-gain ng weight. Tama ba na at 2 weeks ng infant bigyan na soya na inabit na, or I think she's saying na pwede na daw bang mag-introduce ng soya bit by bit. I think that's That's the question. Pero there's a lot of questioning this one, Dr. Teresa.
The first 6 months, the baby should be exclusively breastfeeding. Ibig sabihin, hindi ho magbibigay ng kahit na ano, kahit ho tubig, kahit ho vitamins, unless na lang po yung doktor po pinabigyan po talaga ng vitamins or kung ano-ano nang dahil sa meron pong karamdaman yung bata. Pero for most normal babies, the first 6 months po, dapat po wala pong ibibigay na kahit na ano. Paglagpas po sa ika-6 na buwan, pataas po, ipagpatuloy po ang pagpapasuso at pwede pong bigyan ng complementary feeding. Yun po ang para sa akin ay mixed feeding. When you're mixing the breastfeeding and the solid feeding. So, ang solid feeding, meron po yan yung tamang kain nga po eh. Yung magsisimula ka sa mga gulay, marami po yung mga iba't ibang klaseng gulay na pwedeng ibigay kay baby. And then, bibigyan nyo ho ng breast milk. Minsan, napapabigyan na po natin ng konting tubig na malinis pagkalagpas po ng 6 na buwan, pero yun lang po. Hindi po tama na pagkalagpas ng 2 linggo, magbibigay ka ng soya kasi pwede ho yung makasama sa bata. Pagkatapos ng 6 na buwan, ang soy po para po yung kasi mga peanut. So iniintay po natin yan hanggang medyo mas malaki-laki po sila, mga 9 na buwan pataas, bago po mag-introduce ng mga ganun pong klaseng pagkain. Pagdating po ng 1 year, mas maganda po, tuntunan po nila ang pagbibigay din po ng solids. Kasi yung sinasabi po ninyo na parang maliit po, parang payat po, hindi naman po ibig sabihin nun, pangit po ang katawan ng bata. Kaya nga mas maganda mag-guide po sila ng pediatrician. Kasi yung pediatrician po ng bata, i-check po kung gaano po kalaki yung bata, gaano po kataba ng bata, at maaabisuhan po ang inyong anak kung paano po yung dapat na ibigay na pagkain para po makatulong sa paglaki. Pero yung breast milk po, mas maganda ituloy-tuloy pa rin po kasi para po dun sa kanyang immunity.
Ayan. Thanks, Doktora. Rains, any more questions?
We have one more. Actually, madami po tayong questions. From Miss Marilyn De Jesus Cortez. May newborn baby po akong neighbor na naiwan pa sa hospital ang mother dahil may bronchiectasis po siya and waiting for the result ng COVID test. Ano po ang best feeding formula sa baby na nahiwalay sa mother? Ang sad ng story.
Okay. Ako, para sa ibang tao, complicated daw ang sagot ko. But for me, it's a very simple thing. Si mommy should already be advised to try and express milk. At kaya po yung gawin, hindi lang po through a pump, pero through hand expression. So, dapat po sa ospital o di kaya kung meron pong barangay health workers that are trained in lactation, matutulungan po siya paano mag-hand express at unti-unti ibibigay po yung gatas na yun kay baby. Pag hindi po makakuha ng gatas through that o hindi po sapat, pwede po tayong kumuha ng donor breast milk. Dito, meron pong mga milk bank po na open in different hospitals. The biggest one is in Fabella, na pwede pong pagkuhanan ng donor breast milk at ibibigay po to via cup. Ngayon, pag talagang hindi na po mabigay yung either donor breast milk or di kaya po yung breast milk na galing po sa mother's own milk, saka po ako mag-a-advise na mag-isip ng formula. Yung formula po na yan ay nasa discretion po ng pediatrician niya po. Mas maganda po, ipatanong niyo po doon sa pediatrician po ng bata.
Ayan.
Dapat po yung mommies na nahiwalay sa mga anak. Thank you for sharing that. Opo. I like that. Ganda. Opo. Doktora, ako naman ang magtatanong. Doktora, I thought naman po sa questions. Actually, I asked it lalo na since me, I live in a barangay. Ano?
And
Usog?
totoo po ba, pag may matanda na katabi ng baby nyo and you happen to be breastfeeding, eh baka daw mausog yung baby. Totoo ba yon? And why do people keep telling me this? At meron pa daw puwera usog. And then my husband later on
Dalawa
this
yun.
morning said, ano daw, banis daw yon. What is this? Opo.
Tapos nilalawayan pa.
Oo,
um,
lalo na daw sa cute.
um,
Oo, tapos sasabihin na puwera usog. Sa Pampangan daw, banis daw yon. I don't know, doktora.
oo.
Please help us. And meron bang ganon? And dapat daw we should not breastfeed beside matatanda. Kasi kung hindi daw, mauusog daw yung baby.
Okay. Ako po, hindi po ako nagda-double in alternative medicine. But, yun po, ang but I've heard, I have some friends who do, and they say it's all about the energies. Yung usog daw is all about the energies. That somebody brings energy, a negative energy into the picture. That said po, hindi po kasi talaga ako naniniwala sa usog. I think a
Ako din.
breastfeeding mom, opo, I think a breastfeeding mom po, pag nagpapasuso kayo, you should do it wherever you feel comfortable. Pag nagutom si baby at nasa gitna po kayo ng bukid, kahit po kung ang available lang pong upuan, may katabi po kayong matanda, go ahead, upo lang po kayo, basta po siguraduhin niyo po kayo komportable. Ang importante naman po, kay public po o private po yung lugar na pinagsususuhan nyo, komportable kayo. Alam niyo, dito sa Pilipinas, maswerte tayo kasi we actually have laws that protect women who do public breastfeeding. Sa States, hanggang ngayon, pinag-aawayan pa rin yan nila. And there are many countries where public breastfeeding is frowned upon. But here in the Philippines, we actually have laws that protect women who want to breastfeed out in public.
Ayan. So, hindi rin kayo na, ako din, doktora, I don't believe in usog. Doktora, anong reaction niyo dito? Yung kanin daw ay nasa kanan at yung tubig ay nasa kaliwa.
Ay, ma'am, narinig ko na rin yan. Kaya kailangan pareho. Oo. I think it was a simplistic way lang po of explaining bakit kailangan parehong suso yung ibibigay dun sa bata. Ang katotohanan niyan, yung lumalabas na gatas sa kaliwa, ganun din naman po yung gatas na lumalabas sa kanan. In terms of amount, medyo nagbabago lang po yan ng konti kasi hindi lahat ng babae equal po lalabas na gatas sa kaliwa at kanan. May iba pong mga babae na talagang sadyang pinagpala na napakadami sa kaliwa, pero sa kanan kakapiranggot or vice versa. So, pero in terms of kung ano po yung composition and makeup niya, pareho lang po. Ngayon, sa pagkakaintindi ko na nasabi po sa akin ng aking mga teachers dati, way daw po yan ng mga matatanda para ma-encourage yung mga nanay na bago na ibigay ang kanan at kaliwa sa pagpapasuso, lalo na sa unang mga araw ng pagpapasuso. Kasi importante yun the first few days of life, you really have to give both the left and the right breast to be able to encourage the lactation para lalong ma-stimulate yung lactation. So, I think that was a way for the moms to be able to counsel their daughters or daughters-in-law na bakit importante to give both right and left.
So, doktora, both right and left are equal naman.
Yes, ma'am.
Paano po ba? Should you spend all the time on the one and then transfer to the other, or okay lang ho bang one side lang? Or pilitin niyo ho bang right and left in one
Depende po siya, ma'am, kasi talaga sa ano it depends on the um it really depends on the child. Sorry, on the child, tama, and the mom. Meron po akong mga ibang pasyente na sa simula, only to get the stimulation going, talagang sinasabi ko tuwing mag-feed, do the right and the left. It doesn't matter if it's 15 minutes, 20 minutes, 30 minutes on one, and 1 minute, 2 minutes, 3 minutes on the other side. Eventually though, darating po sa point na kaya pong yung bata sa isang breast lang and then the other breast hindi na po kailangan. So, pag gano'n, sasabihin ko, pagpalit-palitin nyo na lang every time na magbe-breastfeed. May ibang mga mothers na for one reason or another, kailangan sa isang suso lang sila makakapagpasuso. Kasi yung kabilang suso na operahan, merong sugat, may problema. Basta ang importante, may stimulation ka. If you have two functioning healthy breasts, you stimulate both equally. It will be up to you, depending on the mom, what is her comfort level. Kung may iba pong sobrang sensitive, hindi po kaya na yung baby nandun ng matagal So, pag gano'n, sasabihin ko sa kanila, pagpalit-palitin mo na lang. Pero yung iba, kaya nila. So, one breast at a time.
Okay. So talagang no it ako mostly left side si baby So
Yes.
lumaki naman. So
Opo.
wala naman hong ano. Though one time I asked the kanin sa kanan and tubig sa kaliwa and then somebody told me, no ma'am, baliktad. Kanan po yung tubig and kaliwa po yung kanin. So nataranta. Pero actually parehong mali. Okay. Yes. Ayan po. Doktora, another question. Parang I can read it naman. Sige, Rains, babasahin ko. That's true po. Breast milk is much better, excellent for the baby kasi punong-puno ng antibodies and more safer than formula. Hindi napapanis, mas mabilis ibigay sa baby at kahit working mom, pwede na din pong magpadede kay baby. Just pump and put into the freezer para may maiwan kay baby na gatas ni mommy. This is from the yaya po ng anak ko and my breastfeeding coach yaya. Opo.
Wow! Very good. Good job,
Opo.
Ma'am Mirna.
Ay, doktora, can you tell us, nabanggit na po niya yung working.
Yes.
Meron pong myth na once you start working, dapat daw mag-formula ka na. Can you tell us something about this?
No. And I can tell you that it really doesn't matter kung anong line of work ni mommy because I have among my previous patients, mga people who travel for work, people who are flight attendants, people who stay at home and do their businesses at home, people that go to work, government employees, bank employees, they run the whole gamut. All of them, they have found ways to be able to pump their milk, to express their milk. Kasi iba ho sa kanila, lahat na ng pump, Rina, wala talaga ng work. Ang nag-work lang, hand expression. So, as long as they are able to express and they're able to express within a certain period, yung parang kunwari, si baby nandun, so about every 2 to 3 to 4 hours, then they bring a cooler with them, they go home. As long as they're able to do that, you do not need to put them on formula.
So, thank you, Doktora, for sharing that with us. So, Doktora, I wanted to ask you para, break lang po muna sa mga myths and breastfeeding.
Sure.
Opo. Can you tell us your personal journey po? How did you, kasi ang dami pong pediatricians, but very few are lactation specialists. So, can you share with us po kung paano po, what is your practice now? Do you still do general pedia? Do you mostly counsel po? Do you do classes? I-share nyo po sa amin yung journey nyo as a lactation specialist and a pediatrician first and then a lactation specialist din po.
As far as a pediatrician, I've always wanted to be a pediatrician. I think one of if one of the first things I told my mom when I was 3 years old was I wanted to be a doctor, at 5, I made up my mind I was going to be a child's doctor, and that was it. I was in second year residency, I think. And my sister, my older sister, unexpectedly went into labor and gave birth at 29 weeks to my youngest niece. Um, she was 29 weeks, she was preterm. And on the day she was born, may bagyo po. Nobody could get to my sister. The phone was open. We heard her delivering. In fact, even her OB and her anesthesiologist barely made it to the hospital. Um, and our neonatologist who took care of my beautiful niece was Dr. Mian Silvestre. And Dr. Mian Silvestre was, I can say, one of the few people that I do credit with starting me on the journey, because she was very adamant to my sister, your child is preterm, we cannot not breastfeed. My sister previously had given birth to healthy kids, and at best siguro they breastfed for about 2 to 3 months, and then no. Um, After noon, um, I was very worried because sabi nga ng sister ko kailangan daw mag-breastfeed siya. I got my Nelsons. Nelsons is the is a 3,000 page textbook for pediatrics that we had at the time. I opened it looking for information on breastfeeding. Um, and it was maybe all of one paragraph. In a 3,000
Wow.
page book, it
Oo.
was like one paragraph. So, medyo nagpanic ako, and I asked for help from the second person who I also credit with the breastfeeding journey, which is Dr. Lourdes Martinez, who was at the time and is now the head again of Makati Medical Center, because that's where I did my residency. And between her and Dr. Mian Silvestre, they set me on that path. I started learning more and more about breastfeeding. And then I took my um, first training under Dr. Patricia Ko, who's an IBCLC like me. And then after that, it was um, I will just say I think the universe talaga really meant for me to do it, because it literally was I went from one mentor to the next who just opened doors for me. And I think what solidified it for me was when the Philippine Pediatric Society decided they were going to be serious about breastfeeding, and they wanted to create a committee. And my chairman at the time, Dr. Leos, sent me to the meeting. I was the youngest consultant in the group. Ma'am, alam niyo naman yan, pag kayo yung pinakabata, kayo
Ay, oo
yung
naman. Oo,
nagpapadala.
ganyan.
So I was sat there for the meeting, and then it was like, oh, these are my people. And after that, I took training for lactation very seriously and took my exam. And people, a lot of people look at me and they think that I know a lot, but actually, I consider myself a student. I'm still a student because I'm still learning from people. There are so many people ahead of me that know so much more about breastfeeding. Even now, I'm still learning from Dr. Silvestre and learning from Dr. Martinez. And like this morning, I was learning from Diane Spatz and Dr. Libadia and my fellow IBCLC, Kathy De Leon. And yeah, and now I do mostly corporate work, but but I'm mostly in lactation. That is when we're talking patient care, I am mostly in lactation.
Ang ganda naman, Doktora. Thank you for sharing that. So, saan po yung clinic? So, we can send you po mga moms na nahihirapan o mag-breastfeed or kids who can't latch, parang ganon. Opo.
Yeah. You can get in touch with me through Asian Hospital. So I on e-consultation and for online appointments, it's www.asianhospital.com, or you can call Asian Hospital through 8771 9000. Sorry, lagi ako nabubulol
Yung
doon.
mga hindi makalatch ang anak.
Yes.
Doktora
Um,
Michelle.
and also, just to let a lot of people know, so the Philippine Pediatric Society Breastfeeding Committee just opened its Facebook page. You can
Sige
actually
po,
get in touch with
pakibanggit.
us there.
Opo.
Yes, it's on Facebook, TPS Breastfeeding Committee. You can look us up. And for a country of 105 million, there are about 19 IBCLCs over the entire country. We have some in Visayas, we have some in Mindanao. Majority of us are in Metro Manila. So it's not just me who's also doing this breastfeeding work. Again, here in Asian Hospital, we have Dr. Elin Go, Dr. Christine Lapus, who are consultants just like me. And yeah, and all of us would be more than happy to help people who reach out to us.
Ayan. Thank you for sharing that, Doktora. Ipa-flash po natin yan later. Thanks also for sharing your journey. At least alam po natin na there are now pediatricians who are very much interested to help moms breastfeed. O, Doktora, balik tayo sa mga myths and true or false. Ang dami pa rin eh.
Sure.
Doktora, may nag-text. Pag meron na daw teeth ang bata, dapat tumigil na. Is that true?
No.
Kasi nangangagat na raw.
False na false.
Sige po.
Yes. Some babies start having teeth at less than 6 months, some after 8 months. But somehow babies are able to latch without harming the moms. Every once in a while, minsan naughty, they become naughty eh. They know that will have a reaction if you bite. So all you have to do is just tell them no firmly, unlatch, and then relatch. But just because they have teeth, it shouldn't scare you and it shouldn't stop you from breastfeeding. And in fact, some babies will go on to breastfeed for more than 2 years. Kasi ngayon, ang sinasabi natin, 6 months to 2 years. But some children go on and breastfeed for more than 2 years. It's not wrong. It's not unnatural. It happens. It just happens. Some children just stop their journey on breastfeeding a little bit longer than the other person. So just teeth is not good. Should not scare you.
Sige. Okay, thanks, Doktora. So, if your baby, yung akin hanggang 5, so kaya. Okay? And when he bit me, Doktora, I squashed his mouth. He never did it again. Natuto. Okay, Miss Rain. Next comment. From Miss Nina, good afternoon po, Doktora. Ask ko lang po kung makakasama po ba ang mag-side lying kapag nagbe-breastfeeding. Is it bad po to side lie while breastfeeding, Doktora?
No, sideline is in fact one of my favorite positions because it allows both the mommy and baby to rest, therefore allowing daddy to rest also. Um, Side lying is also important because when you're breastfeeding upright, ang nade-drain lang ng milk is mostly the upper part of the breast. The lower part of the breast, some milk collects there, but the baby is not able to efficiently take it out. When you're side lying, because you change your center of gravity, because kumbaga parang mas na iiba yung posisyon ng gatas, mas nakukuha ni baby. So in fact, I have moms where they're very unsuccessful in breastfeeding upright, actually do really good on sideline. So If you're good at side lying, keep it in your pocket. It's one of the best ways to breastfeed.
Ayan. So, side lying is very okay. Ayan. Better pa nga kasi nade-drain yung ibang parts. Ako din, nung sa
Right?
gabi ho, nagsaside lie yung anak ko.
Yes,
Actually, I found it very restful. Opo.
yes, ma'am.
Ayan, from Elisa. Hello, Doc. Ask ko lang po if mag-seafood po ba totoong na mangangati si baby. Doktora, totoo bang if you eat seafood, mangangati ang anak nyo? I guess that has something to do with allergies. Opo.
Yes. Um, it's not true that once a mom has allergy to one thing that the baby will become allergic to it. That's actually a common question in pediatricians. Remember that whatever we take in gets processed first before it gets to the breast milk anyway. Um, kung kayo po nangangate sa seafood, maganda po na hindi na lang po kayo mag-seafood para kayo po yung hindi mangate. Pero kung wala po kayong allergy sa breast sa seafood, ang seafood po, maganda po siyang source of iron and in some cases calcium. And in fact, yung halaan po na sopas is uh, one of the good ways that you can help increase your milk production. Hello. Hello, Doctora.
Okay, Doktora. Next. Opo. Ayan. Doktora from Beebs. Hello, Doktora. Ano po pwedeng i-recommend sa postpartum
Hives. Pwede
allergy?
po.
Hindi po ako nakaka-apekto kay baby sa milk supply. Saan po, sana po manotice yung tanong niya. So, she is the one allergic.
Yes.
So, she wants to ask po, can she take anti-allergy pills po while breastfeeding? Ayan.
Postpartum hives.
Are there anti-allergies against breastfeed? Pag nagbe-breastfeed po, should you not take anti-allergy pills? Hindi ko po alam.
No. You can. You're actually able to take a lot of medications. Interestingly enough, there's a lot of medications you can actually take when you are lactating. And for the doctors out there, it's a resource called LactMed, LactMed, and you can look it up on Google. There's an app for it on both iPhone and Android. You can download it, and it is updated daily, if not every other day. And you can just look it up so that when you have patients that come in and ask about what medications are safe to take, you can look it up. Most histamines, most anti-allergies that we have here in the Philippines are safe for breastfeeding except for those that have steroids in them. Kasi meron po tayong anti-allergy na may steroid po na component. Kung anti-allergy lang po siya na plain, wala pong kaso yon. As for the dose for the anti-allergy, it's best to consult your physician.
Oo. Tsaka, thanks for that. At tsaka kung kayo naman ho si Mommy, avoid yung mga pagkain na nakaka-allergy sa inyo as much as possible. As an
Yes.
internist, yun naman ang sasabihin ko, don't eat allergic foods unless talagang nangyari. Upon which, dalawa na lang kayong pumunta sa doktor, yourself and the baby. Thanks,
Although,
Doktora. So there's an online na pala, online course for
yes,
medicines on lactation.
yes. Just as a additional note, there are some women I notice that have yung sinasabi niyang postpartum na postpartum hives. There's some women that they're very sensitive that for some reason nagkakaroon lang sila ng hives out of nowhere. I do suggest that you go and get a consultation, even teleconsultation with your OBGYN, or if they're not available, look for an internist, an allergologist that can help you.
Check din po.
Yeah,
Pa-check.
it has to do with the hormones po eh. So usually as the hormones of pregnancy go down, nawawala din po yung ano na yon, yung pangangate na yon.
Ah, so, pa-check. Oo. It might be hormonal. Opo.
Yes.
Sige. Thanks, Doktora. Parang may nagpa-flash pa ata.
Good afternoon, Doktora. Ask ko lang po, ano pwede i-take na pills pag nagpapa-breastfeed? 1 month pa lang po nung 25. Pills. Okay. Um, ah, our usual suggestion, lactation consultants will suggest that progesterone-only pills are the best OCPs, oral contraceptive pills to take if you intend to do breastfeeding pa rin. However, we do suggest if you can find alternative ways to prevent pregnancy, that's better because ang problem with pills, it is hormones kasi at the end of the day. But if you're pushed against the wall and you want to take the pills and your choices are the progesterone versus estrogen plus progesterone, go with the progesterone. But again, consult your physician.
Consult your OB. Oh, yes. Thank you, Bianca. From Miss SP. Paano magpapa-self-diagnose if may clogged ducts? Any home remedy po kapag sumasakit po yung breast? If may sugat po yung utong or masakit po yung breast part. Ayan. Dalawa po yung tinatanong niya. Clogged ducts and sugat po.
Sugat. Okay. I will answer second question first. For the sugat or the yung parang feeling nyo parang may paltos na yung may nipple part of your breast. When you breastfeed, especially at the beginning, it's common to feel that. One of the best ways pa rin that I've seen is to put breast milk on the sugat or on the nipple part. And usually, if you place a few drops of the breast milk, express breast milk on it, and then let it dry. After a couple of days, you will see that it will heal up properly. Making sure that your nipples and your breasts are dried up before you put on your clothes is a very good way to prevent further injury and also prevent thrush or fungal infections. The first part, yung what are good home remedies for clogged ducts. I do suggest a warm compress doon sa breast, over the breast before you start the breastfeeding. And then you can do simple massages on the breast. You can look at it in YouTube. You can actually look for it on YouTube. Breast massage, yes. And you can do it gently kasi minsan ng mga babae tayo mga babae sobra tayong sadista. Do it gently. You can massage after the warm compress and before feeding or before expressing milk, and then making sure that you are draining the breasts completely every feed. So again, going back to yung isang question, side lying is one of the positions that's actually really good for clogged ducts.
Kasi yung ibang parts na
yes,
parang may gravity.
Yes, the drain.
Okay. Ako po magtatanong. People always ask me, if you're tired, should you breastfeed?
The answer is yes. And I think that if you're very, very tired to the point that you'll fall asleep, then that's probably the only time I'll say no. Matulog ka muna. But being tired does not affect the volume of your milk or the quality of your milk. So even if you're tired, if you get a comfortable position and then you breastfeed, breastfeeding actually increases the feel-good hormones, oxytocins, and the serotonins, which will help relax you and which will also help you in feeling less tired.
So baka ma-relax ka pa while breastfeeding the baby.
Yes, it's actually
Oh.
you're breathing in the scent of the baby.
Doktora, ito forever nakikita ko sa mga breastfeeding forums.
Yes.
Parang marami yung naiiyak dahil yung na-pump nila, like half cc lang. Paano naman daw, ano daw ang kinakain ng anak nila kung yung na-pump nila ay kalahating cc lang? So basically,
Um,
parang failure of pump. Parang hindi sila maraming napapump, so nagpapanik
yeah,
po sila.
okay.
And nade-depress, kasama na rin nun.
Right. I will say that, in direct breastfeeding, hindi natin masasabi talaga yung volume. So, minsan, mas marami pa yung volume ng direct breastfeeding rather than in the pump. So, I usually do not use the volume of milk that is pumped as a guide to me kung how much milk this person makes. Another point is that actually hand expression is much better than an electric or a manual pump in getting expressed breast milk. So maybe you can learn how to do the manual expression and it will help to increase your volume. If, for example, yung volume of the milk that you really are producing, whether it's manual or it's hand expressed or it's electric pump, plus your baby seems to be lagging in terms of the weight, I think it's time to talk to your pediatrician or obstetrician and maybe get a referral. Or if you want, again, you can look us up in www.asianhospital.com, and myself and the other lactation consultants and the lactation counselors that we have here would be more than happy to help you. Also, you can also look up peer counselors that are available online. There are many groups that can help you. Kasi kung some women, they have an issue about going to a doctor or a health professional eh. Gusto nila yung peer nila. So you can look them up, yung mga breast friends nyo, and then they can help you. They can give you advice on what to do to help increase your milk production. Hindi po lahat ng mababang milk production nasosolve ng pag-inom ng gamot, hindi po lahat nasosolve ng a better electric pump. It's not an one size fit all na answer.
I usually tell people, Doktora, that some people haven't been able to pump anything pero napalaki naman nila yung anak nila through breastfeeding. So I guess that's okay.
I have a patient that mom breastfed for 2 years before she really had to stop. But in the full 2 years, she had to make arrangements with her office because she could not pump at all. Siguro at best, she'd bring out like 10 ml in 24 hours. But every time she brought the baby in, the baby got bigger and bigger and bigger.
So yun na yung proof pag lumalaki
Yeah.
ho yung anak nyo.
Yeah, it's
Doktora,
not.
another question that people often ask me po. Pag dede daw ng dede si baby, that means parating gutom. So therefore, hello formula na raw.
It's not, again, it's not hindi siya it doesn't encompass all the babies. Yes, it's one of the things that we might be looking at kung mababa ang volume, but a baby might be going through a growth spurt, so di kain siya ng kain. A baby might be teething, so hindi siya actually nutritive sucking, but it's more of comfort sucking. And some babies just really like to suck all the time. One anecdote I can say is I once had a teleconsultation of a mom who told me, I think I have low volume because my baby just keeps on suckling and suckling. At night, there's hardly any interval. So parang at this point, the baby was about 4 months old. Halos natutulog lang siya sa isang gabi ng maybe at best 2.5 hours, because that's all the time the baby would give her. The whole time the baby was suckling and suckling. So her husband was saying it's time to put the baby on formula because you're not getting any sleep. You're getting so stressed out. So she reached out to me, and so we were talking. She wasn't turning on the video yet. And I said, is it fun? At this point, we've been talking about half an hour. Maybe can you turn on the video? Because, it's hard to really assess if I don't see the baby and I don't see anything. So I'm expecting to see a small, maybe thin child, because the way that she's describing the situation. So camera opens to a we're talking big butchok baby. And I said, no, I was looking for your baby. Yeah, that is the baby. So as it turns out, this baby just likes to comfort feed all the time. Pero actually, kaya naman pala ibaba. Yun lang, even in his sleep, may gumaganon. So, mom was told, if the baby does that, you're supposed to feed him again. So, it was getting to the point na sumusuka na yung bata. Coffee feed niya. Kasi nga, kahit tulog, gumaganon lang yung bata. So, the lesson there is, just because the baby keeps on feeding doesn't mean that it's low supply. So have yourself checked if you're really unsure. And again, peer counselors, lactation consultants, we're all here.
Ang cute naman ng story yun. May mga baby gusto lang sigurong tumambay dun sa nanay nila din, Doktora. Because it's really fun. That was a cute story po. That was a really cute story. Ayan. Prince, any questions pa? Okay. Doktora, I wanted to ask you a few questions about
The right time to wean.
Doktora, hindi po narinig yung questions. Can you repeat that again?
When is the right time to stop breastfeeding naman po? What do you think?
The right time to stop breastfeeding is when what I say is when the mom and the child mutually come to a decision that it's time to stop breastfeeding. Majority of my patients stop breastfeeding just one day. It will just happen. Some babies happen before they're a year old, and in which case talagang we really work hard to try and get them to feed again. Pero talagang kung ayaw na, then we really have to work on the diet, not formula follow on feed or anything, but the diet. Some babies will stop that one day after they blow out their 1 year old birthday cake for some reason. Oh, I blew my birthday cake, I'm done. And in which case, yeah, they just decide to stop. Nothing happened. The mom, in fact, will call me crying that, something is wrong with her child. They come in and the child is completely happy, but you give the breast to the baby and she goes, no, no, wala lang. They just don't want to. Some babies will wait until they're 3 years old before they decide, okay, I'm done. So it's a big range of reasons and timing, and again, it has to do with how the mom feels regarding the breastfeeding. Some moms really have to stop the breastfeeding before the baby turns one because they get pregnant, and then the new pregnancy is delicado. But pregnancy, in fact, and some OBs might not like my statement, but pregnancy does not preclude breastfeeding. If you are healthy, if you are not contracting, if your baby in your womb is not is not losing nutrients and is not small for gestational age, I highly recommend continuing breastfeeding. I have moms where they breastfeed until the day before they give birth. They go into the hospital, then they resume breastfeeding in tandem after a few hours after they've given birth. So um, the stopping of the breastfeeding is a personal thing. It is different for each person. Wala akong formula na, okay, I breastfed for exactly 365 days, okay, enough. If that's your decision, nasa sa inyo po yan. But I will tell you that the weaning of a child, if the child is not included in that decision, is very hard. Kahit maglagay po kayo dyan ng siling labuyo, hindi ho yan titigil.
Oh my gosh, Celia. Oh.
Oh, I have moms that come in. I thought that something was wrong with them. And then they say very sheepishly, naglagay po kami ng siling labuyo para tumigil na po siya mag-feed. Sabi ko, sinong nasaktan? Kayo, di ba?
Oo nga po. Yes. Oh. So talagang ano, yung akin would just stop. Pero he was 5. Oh.
Yeah, some kids,
Wala,
they
gusto
just
niya.
decide. They
For
just
a
like,
long time, he wants to
no,
hold daw. And then, ano, lumaki na, big boy na daw. Ayun.
no, no.
Ayun. Though he was happy naman. Oh.
Yeah.
Doctora, it seems like we have finished all our questions. Can you give us some words of inspiration po before you leave us?
Okay. Breastfeeding is, if anybody ever told you breastfeeding was easy, they're lying through their teeth. Breastfeeding is never easy, but if you prepare for it, if you have the mindset for it, and if you're willing to do some of the work for it, it will be the most rewarding thing that you have ever done. Um, just because you have things stacked up against you, you are obese, you are diabetic, you have COVID, doesn't mean that your journey to breastfeeding ends. Explore it, still try it and go for it before, at the end of it, it's like, if it doesn't happen, then it won't happen. If it happens, then great. The support that you need is not necessarily something that, you know, the hospital or the lying in center or um, anybody is going to give to you. So I really encourage everybody, look around, research, even on Facebook, because I know that a lot of Filipinos can only depend on free Facebook. Even on Facebook, there's so many webinars, so many FB lives and videos on breastfeeding, on its benefits, and you can learn a lot from them. Si Ma'am, meron po siyang mga FB lives even from as far back as the first part of COVID, from the lockdown with Dr. Mian Silvestre and with other guests. You can learn from that. That's such a great treasure trove of knowledge. Look around and decide for yourself. If ultimately breastfeeding is not for you, then uh, okay, I'm not going to force you, but I will tell you that it is one of the best things, if not the best thing, that you can do for your child. Because you're not just giving nutrition, you are protecting your child, not just now in this time of COVID, but even 20 years later from cancers and from heart disease and from obesity and hypertension. And at the end of the day, how many people do you know can do what you do, which is create the human, give birth to the human, and then feed the human for the next X number of months. And then after that, paglaki ng human na yon, you can really say that this human did something good for the society. And even you as a breastfeeding mom, you did a lot to be able to allow that child to do that for the society. So that's it.
Thank you, Doktora. Very inspiring po.
Thank you, ma'am.
Thank you so much, Doktora. Asian Hospital, and also the Philippine Pediatric Society Breastfeeding Committee, Doktora
Yes,
Teresa
ma'am.
Ribano. Thanks, Doktora. Ingat po.
Thank you. Ingat po kayo.
Stay safe and healthy. Salamat. Rains, thank you so much, Doktora.